we've seen significant surges in the Omicron variant over the past several weeks. And fortunately, however, we are seeing that our overall numbers of cases are trending downward. Our adult correctional health team identified an outbreak the week of January 10th in the jails. It has spread rapidly due to the high infectious nature of this variant. And as of today, there were 178 cases in the main jail and 126 cases at our CCC, for a total of 303 cases. For context, the daily census of the jail has been approximately 3,300. There were 203 sentenced inmates that were released 90 days early. 7 additional inmates with conditions which may make them immunocompromised were also released. We also saw an increase in the cases among our unhoused community members in shelters, with several outbreaks reported over the past few weeks. Our public health team has been supporting the shelters to implement isolation and quarantine strategies so folks can remain in shelter when they contract COVID-19. Additionally, we provided our partners who work closely with encampments additional masks, hand sanitizers, and public health flyers to help individuals learn how to manage their symptoms when they are unhoused and when and where to seek medical support. Given the Omicron variant and waning immunity from vaccinations, the state has updated 3 current state health officer orders to change the wording from fully vaccinated to up to date, which includes receiving a booster if eligible. There are several populations that will now require boosters to be considered up to date. Originally, the requirement was to be due by February 1st. However, the state is moving this to March 1st due to the challenges in getting folks vaccinated. With regards to mega events, effective January 15th, the threshold for indoor mega events was lowered to 500 attendees, and the threshold for outdoor mega events was lowered to 5,000 attendees. And with that, I will turn it over to Dr. Kassirier for her updates.
Before we go to Dr. Kassirier, Siobhan, can I just ask?
There's this whole series of things that happen to people inside because of the sheriff's decision making about this that really has little to do with public health and has everything to do with, reputation. And what we've seen is they're not amenable to these precautions that we need, and we need to take more serious measures to hold them accountable. Public health experts have called for 50% population reduction in the jails. 200 folks didn't even touch the overall jail population because that rotating door inward, like I mentioned.
Individual who told me that since COVID's happened and they've been in their pre-trial, like 80% of our jail population, meaning not guilty, pre-trial, for almost 4 years now has been sitting inside of our CCC, and that since COVID has happened, that there has been no difference except for that people are getting sick and they feel like they have been sentenced to a death sentence. So I'm going to say, what efforts is the County Board of Supervisors and even the public health officer and Dr. Kassirier doing to put pressure on Scott Jones and in a jail reduction effort? We know that this is happening not just because of lack of access to things like hygiene and hygiene supplies, soap, and masks, but we also know that most of the staff are not vaccinated, don't want to be vaccinated, and are not wearing masks. Already off top, just that place is unsafe because of the people you've put in charge to run that facility. Even those who get access to medical are only given so because of it's at the officer's discretion.
Yes, thank you. Siobhan, you mentioned the numbers in the jails. Are these people who tested positive, and were they asymptomatic or symptomatic?
I don't have a breakdown as to how many of them were symptomatic and how many were symptomatic, but we know there's a mixture.
To me, that even though we understand that the sheriff has certain autonomous powers beyond the Board of Supervisors as a duly elected county official, that we still have input and some kind of impact on.
I think because some of the questions, would be best addressed to leadership within the sheriff's department as to some of the comments, but certainly questions from board members. So, and I would ask if that's possible to, when we have these reports, to invite a sheriff's representative to be available if they could. Any thoughts?
Yeah, that we can work on that for sure.
Okay.
So our responsibility is by law to offer informed consent. So I'd be curious to know, what is the protocol that we're going through to make sure that people have that informed consent?